Welcome to 10 Kids, 2 Docs. I'm Dr. Sylvia Bank, and I'm joined by my good friend and co-host, Dr. Vivian Carlin. Between our two households, we're navigating life with 10 children, so we know how chaotic parenting can be. As Johns Hopkins trained pediatricians, we also know the science. Our goal is to bring you the best of both worlds, medically sound, trustworthy advice, and practical, real-world insights as we dive into the trials and triumphs of parenting. Please note this podcast is not intended to be a substitute for medical advice, diagnosis, or treatment from your doctor. We are going to discuss food allergies, which honestly is a huge stressor for parents today.
Sylvia, I'm excited to talk to you because I know you've experienced it both as a parent and a pediatrician.
Yes, and I definitely see this in the office. Even with children that aren't diagnosed with food allergies, it's a stressor for all parents as they're introducing solids. How do I introduce these foods? What does the allergy look like? All of these questions can arise for every parent who's feeding their child. So it's a much needed topic for everyone.
Yeah, so I feel like what we should do is let's focus our time today on infants. You know, that infant that presents with symptoms of food allergy. By the way, just as a caveat, there's many food allergies that we see in infants that children eventually outgrow. But let's start with that initial, what does it look like when you have a food allergy presenting or being diagnosed in an infant? And I would love for you to start us off. Tell us your story of what that looked like for your house.
So I'm a parent of multiple children that have food allergies. And for the infant story, I do want to focus on one of my children. So the first time I think we noticed a food allergy in this child, this is actually my first child, was before he even started solids. We were only breastfeeding at that point, and we were actually at a pediatric residency party picnic, and I had just had the baby, so I brought him into the party. And a pediatric dermatologist from across the room pointed at my child who had this very severe open wound, weepy, eczematous rash on his cheeks. And he walked over to me and was like, "There's a possibility that your baby may have a food allergy."
Oh, that's funny.
So I actually felt that this curbside consult by this premier pediatric dermatologist in our area, I thought it was really actually fortuitous. It was helpful for me at that point.
Yeah, and how old was your son roughly at this point?
I think he must have been around 3 months of age, around there. So this was before we started solid food. So at this point, once the eczema and the really weepy, terrible skin reaction started, there was a concern that he was allergic enough to whatever he was being exposed through, me eating, processing it in my body, and then through the breast milk, right? So ultimately, he was diagnosed with food allergies after we consulted the doctor, and it was found out that he was allergic to eggs, cow's milk, dairy, and wheat. The wheat was really the hard one. So at that time, because he had severe allergies and that manifestation even before he was exposed to the actual foods themselves, the recommendations for me at that time was that I restrict those foods in my diet so that he would not be exposed to them through my breast milk. And once we began solid foods, we also restricted those in his food as well.
Okay, so let's go back to when you're breastfeeding. And can you just describe that for me? How did you learn to restrict, especially wheat? How did you do that from your diet?
Yeah, we're talking over 20 years ago. A lot of these gluten-free, wheat-free products were really not available at that time. And it was especially hard for me during that breastfeeding time. You don't have a lot of time with a newborn, especially the first time that you're a parent and you're juggling the newborn schedule, the breastfeeding, the sleeping through the night stuff. So it was an added extra when I was already learning how to be a parent for the first time. Avoiding wheat, avoiding dairy, avoiding egg. Those were a lot of extra steps for me in the stress of becoming a new parent. It can also be a little bit depressing. During that postpartum time, a lot of parents can experience some natural depression after you give birth. And often you're very hungry if you're breastfeeding, and not being able to eat a lot of the foods that you're used to eating can be really sad and depressing.
I can imagine you've already experienced so much change and so much like giving up of your own desires to completely serve this new human being. I can imagine that it would be like one more layer of, oh my goodness, something else I need to give up right now.
Yeah. And that being said, for other parents, if there's a large number of foods that your doctor is recommending that you eliminate from your diet when you're breastfeeding, sometimes at that point, it's just reasonable to start on a hypoallergenic formula. So for moms, instead of basically restricting everything that they can eat, that is a reasonable alternatives that moms could seek if they're found in the position that I was found in, right?
Yeah, yeah. And just to clarify, hypoallergenic formula are formulas that are specifically created that have none of these allergens in them because of the way the protein is broken down. And those provide the same level of nutrition and everything that the baby needs. And so even babies with severe food allergies can use these formulas and still get the nutrition that they need. Okay, so he was 3 months old. You started restricting your diet, and right on the horizon is the introduction of solid foods. So tell me about that.
Right. So when we introduced solids, it was actually recommended to us through our doctors that we continue to restrict his diet. Recommendations will vary from person to person. And actually, you'll see later on in the program, recommendations have changed in the last 20 years. But at that time for us, we were restricting those foods in his first food diet. And then as a toddler, we were given the okay to start beginning some of these foods with the guidance of our doctor. And I remember very distinctly one day we were giving him egg, which is often a very soft, easy first solid food. And almost immediately he broke out into full body hives.
Oh.
He was very itchy and irritable. And then at that point, based on that reaction, he was diagnosed with that true food allergy, and we were prescribed the EpiPen at that point.
Oh, I'm sure that seeing him rapidly develop hives was very scary for you. I think this is a good time for us to make a point that if your child has anything that makes you think they're having an immediate or severe reaction to a food, such as hives, that always warrants immediate medical attention.
Yeah, and as a pediatrician mom, I knew that that warranted immediate medical attention, and it was a scary allergic side effect that could happen. Like, we get calls in the office all the time during that first food phase when people are introducing new solids and new potentially allergenic foods to their kids. And if they develop hives, it warrants a visit to the emergency room, right? This is the type of food allergy that people fear, and medical attention needs to be sought right away.
Okay, so you've gotten your EpiPen. He's been, at this point, definitively diagnosed with egg allergy. I'm assuming that the other things that you introduced were okay.
No, so actually, egg was one of the first things we started. And
Okay.
based on this reaction, we were continuing to limit dairy, egg, and wheat in his diet during the portion of his toddlerhood. And then I remember very distinctly at the age of 4, we went to an allergist appointment to see if, when, and how we can reintroduce these foods. And based on some testing they did then, he was deemed at that point to have outgrown his food allergies. So by the time he was 4 years old, he no longer had the diagnosis of food allergies. He could then begin eating these foods, and we no longer had to carry the EpiPen for him. So for him, that was like a turning point in his allergy story. Today, this child no longer has food allergies, and that's kind of how it presented and resolved in his infancy and toddlerhood.
Oh, I can imagine that was one of the best doctor's appointments you've ever been to. Like a weight off of your shoulders as you're leaving that office.
Yeah.
Plus the excitement of letting him go try these new foods. I like this story because this is the story of a fair percentage of kids with food allergy is that they do outgrow it.
Yeah.
Not all, right? And we're going to cover that in another episode.
Yeah, so I think the main point in this story, honestly, and I hope parents can relate to this, is that how terrifying it is for a parent to be going through the process of discovering food allergies in your infant. And even as a pediatrician, it was scary for me. Could this child have a severe reaction at any point? It puts this heightened level of childcare onto the parent, and it can be extremely stressful, right? In addition, I lived in a multi-generational household, and it took a while for my mom to kind of understand what food allergy was. And I definitely feel for people who have children in childcare at this phase when they're really worried about the food exposure at that time. And like the instinct for a parent is you just want to shelter them, right? You want to kind of control all the food so no mistakes are made. And it really kind of leaves the parent in this state of almost helicoptering, like I really need to be on top of this at all times because I'm worried that someone else is going to mess it up, right?
Yeah, I can imagine that food is everywhere.
Yeah.
This constant fear.
Yeah.
You mentioned being prescribed an EpiPen. Tell me more about that.
So we were prescribed the EpiPen, and I want to insert a tip here about the EpiPen. So EpiPens, depending on your insurance, can vary in costs. Sometimes insurances are very reasonable and it's a minimal copay at your pharmacy. But for us during a period of time in this child's toddlerhood, the EpiPen copay was like $100. So obviously we're going to fill the prescription for the life-saving medicine that our child might need. But that's kind of like a hefty copay. So it does vary per insurance. But what I wound up finding out is that hopefully you never have to use them. They expire and then you need to refill, right? Because these things don't last forever. And especially if they're in preschool or going to school, they need to have up-to-date fresh EpiPens at the school nurse or for the preschool provider to have. And what I found out is that the expiration date from your pharmacy's EpiPen can greatly vary. And if you're filling the prescription at the beginning of the school year, you want that prescription to last the whole school year. And sometimes they give you one that expires in like 6 months. Then you have to get another prescription and copay just to fill it again. So when you go to fill your prescription at your pharmacy and you go to pick it up, you can look at the EpiPen expiration date. And if it expires too soon for your liking, like within a couple of months, then you can refuse to pay for that EpiPen. You can tell the pharmacist, no, thank you. I don't want to pick up this prescription. I'm going to fill it somewhere else. And then find that pharmacy where you have the longest lasting EpiPen so you don't have to pay for it again within the year.
Oh, that's a really interesting hack that I have never thought of. I'm so glad you brought that up.
The other thing about the EpiPen, which is kind of like a parenting reality, is the training, like that thought and fear that I'm now holding this needle in this plastic tube that I may have to like save my child's life by jabbing them with this needle. And for some parents, that is just terrifying. Like, I've never given a needle to anyone in my life. And now I'm expected to do this when my child is on death's door. So, like, I just want to reiterate, the EpiPen is not a trivial thing for some parents. And that fearful thought of the EpiPen is real, right?
Yeah. I like to reassure parents that there is not really any downside to giving an EpiPen. If you have any concern that your child is having a severe or certainly life-threatening allergy to food, you always err on the side of giving the EpiPen. But it's super important to know that anytime you've given an EpiPen, that child needs to be evaluated in the emergency room. And it's not necessarily because of side effects of an EpiPen, it's because that often, after that epinephrine has worn off, after 15 or 20 minutes or so, the allergic symptoms can return. And they can return in such a way that the child needs more emergent care in the emergency room. So we really want them to be monitored by a doctor during that time after an EpiPen has been given.
Yes, absolutely. So the mantra is, if the EpiPen is given, you must go to the emergency room. There is no decision point at that time.
Yeah. So in the second half, let's go over some of the guidelines now with introducing solids.
Sounds great. So when we're talking about food allergies, a lot of people already know this, but just to clarify, true food allergies can be severe and life-threatening. This is why it's such a concern for parents. It warrants a discussion, guidance, and management from your doctor or even an allergist if your child has this diagnosis.
Severe reactions to food are called anaphylaxis. Those are severe, rapid, immediate allergic reactions, and they always warrant emergency medical attention. Because of the seriousness of food allergies and a fear of these serious reactions, this area has been the focus of many pediatric studies.
Yeah, in fact, a lot of these studies have changed the recommendations in your and my clinical practice lifetime, right?
Yeah.
So when we came out of our residency during that early phase of our careers, the recommendations at that time were actually to avoid allergenic foods, especially peanut in the first 2 years of life. Like every child in America was told to not be exposed to peanuts until after the age of 2. And those recommendations have dramatically changed in our pediatric career lifetime, right?
Yeah, this is why research is so important because logically it kind of made sense. Like if we just don't expose you to peanut until you're 2, maybe that reduces the chance that you're going to develop a severe allergy to peanut. Well, it wasn't just here in the United States. It was in a lot of countries around the world where they were restricting peanut until age 2. And in 2008, this fascinating study kind of became a pivotal point in food allergy. And it was entitled Early Consumption of Peanuts in Infancy is Associated with Prevalence of Peanut Allergy. And basically, the study was prompted by this realization that Jewish children, so roughly similar genetic pool, that were living in the UK versus living in Israel, had significantly different rates of peanut allergy. So the children that were living in the UK, where the guidance at that time was to restrict all peanut exposure until 2 years of age, had a 10 times higher incidence of peanut allergy than Jewish children that were living in Israel. And the link that was speculated is that in Israel, there was an infant and toddler food called bamba that contains peanuts, and this was very commonly given. And in the UK, again, it was this era where the advice was avoid peanuts completely for the first 1 to 2 years of life. When they did the study and looked at it, they revealed exactly that there was a 10-time prevalence rate amongst children where peanut had been restricted versus children living in Israel. So this became the impetus for changing the guidelines for parents.
Yeah, it's actually allergy prevention at this point. Very exciting news for pediatricians in this prevention of allergy in the early introduction of a food, right? This is what this study previewed and this shift in pediatric allergy, right?
Yeah. And again, it wasn't necessarily intuitive because it seemed like, oh, it makes sense to restrict. It wasn't until looking at the data that we realized, oh, no, it's actually the opposite. Early exposure is somehow protective against developing food allergy.
Yeah, so let's talk about the recommendations now. What do I recommend in the office to avoid food allergies? So first of all, if a baby has severe persistent eczema or an immediate allergic reaction to any food, they are at high risk for food allergy, right? This defines my storytelling of my child, not just dry skin, not just a dry patch, that weepy, oozing eczematous facial lesion that never healed. Like that was his persistent eczema. And of course, the story of the egg and the immediate hives that he developed. My child was at high risk for food allergy. And if your baby has these symptoms, you should discuss the introduction of high allergenic foods with your doctor first. So, if your baby has not shown any signs of being high risk for food allergy, which honestly is most children at this point when you're thinking about introducing solids, then the recommendation is to now begin slowly introducing hyperallergenic foods at around 6 months of age and to do it slowly, progressively, and often after that.
Yeah, and this is where it becomes really important to do them one at a time. Give each one of those high allergenic foods a few days to make sure there's no reaction and then move on to another one.
Yes. One of the tips I sometimes give in the office is when a parent is really, really fearful this introduction of hyperallergenic foods might cause allergy in their child, I recommend that they do it during regular office hours on a weekday. So it's not at night when everything is closed. It's not on Sunday when your pediatrician's office is closed. It's when everything is open.
I love that idea, actually. I also often think in parenting in general, don't try anything new right before bedtime when you want everybody to sleep, because you might find yourself laying there and worrying, do I need to go check on my baby? We just tried something new. That's just not setting you up for success.
Right. So morning hours on a weekday, best time to introduce new foods, right?
Yeah, or as soon as you get home from work on a weekday, you've got a little bit of time, all of that. So as we're going in on this discussion, what are the high allergenic foods that we're talking about? Can you list those for us?
Right. Number one, and a lot of people know this one, is peanut, right? Everybody knows about a peanut allergy. Secondly is other nuts called tree nuts because these nuts grow on trees as opposed to the peanuts that grow in the ground. The common tree nuts that kids are exposed to in their diet are almonds, walnuts, and hazelnuts, but it does include pretty much all the other nuts that we know. The third most common allergenic food in this period is actually cow's milk. Cow's milk dairy like yogurt, milk, butter, and cheeses. So that can be a common food allergy at this time. And the last one that's most commonly seen is the sesame. So, that rounds up the top four. Most food allergies fall in that category, but babies can often react to these foods as well. Egg, soy, wheat, fish, which includes salmon, tuna, and cod, and other fish, and shellfish, which includes foods like shrimp, lobster, and crab. So these are the foods we're talking about here when we're highlighting high allergenic foods.
Yeah, so what does introduction actually look like? Like, obviously, we all should know you never give an infant or a toddler a nut of any kind because it's such a choking hazard at those ages. So let's take peanut, for example. So one way to introduce peanut is that you can often find a product called peanut powder, which is ground up peanut. It's usually sold near the peanut butter in the retail grocery store. And you can take a little dab of peanut powder and just place it on your infant's tongue. Another way to do it is you can actually take peanut butter and mix it with water and make it into kind of a slurry. And then again, also just dab a little bit of that mix onto your infant's tongue. That's all that you need to do. That's exposing their body naturally and, in a stepwise fashion to peanuts or other nuts at these early ages.
I want to point out to the listeners that there's some great resources online if you want to read more and learn more about this early introduction of allergenic foods. And that can be found on the healthychildren.org website, which is powered by the AAP, American Academy of Pediatrics. They have a great page about this, and I'll put a link to that in the show notes.
Yeah, and we've hit on a lot of this as we've been talking, but anytime we have a discussion with a parent about the introduction of solids, we also talk about what signs to be looking for. Like, how do I know if my baby's having a reaction to a certain food?
Right. So the first thing we look at is their skin. There can be skin changes like hives, like I described in my story. Red, raised lesions, they're often very itchy, and they can come and go where you have one in one spot and then that disappears and you get another in another spot. So that is how hives behave. Sometimes children will have skin changes on their face, like swelling of the lips or eyes. This can be a sign of allergy. And lastly, there can be a non-specific itchy rash that maybe doesn't exactly look like hives, but it's itchy and kind of red, and that may be a suspicion of allergies as well.
Yeah, all of those are important to discuss with your doctor. And after we think about the skin, of course, we worry about any breathing symptoms. So it could be, obviously, if you hear any wheezing, that would be a very severe symptom, coughing, sneezing, a sudden development of nasal congestion, anything like that that makes you think that your infant is having trouble or a change in their breathing. And that always also warrants immediate medical attention.
Right. Thirdly, we look at the GI tract, right? They're eating it, they're ingesting it. Sometimes babies can have stomach symptoms where there'll be nausea, maybe vomiting, sometimes diarrhea. Abdominal pain can present, crampy abdominal pain, and then sometimes there's trouble swallowing as well. So these may be signs of an allergic reaction involving the gastrointestinal tract.
Yeah, and finally, and thankfully a little bit more rarely, when we're talking about infants, we can see signs that are more systemic, meaning that they affect the body more globally, and those can be a significant change in skin color, like a paleness or a grayness to the skin color after your infant has eaten, or in a child that's walking around, a lightheadedness or too tired to stand up as if they're going to pass out. This is much more rare and can be associated with other health issues that your doctor would need to address, but obviously something to bring up to your pediatrician that they need to investigate.
Yeah. So for me in the office, obviously, if any of these symptoms that we described seems life-threatening or emergent, then we address those immediately and right away. But if it's something mild, I usually recommend that parents they have their handheld device. Take pictures of what you're seeing. Sometimes this stuff is transient. Sometimes if your child seems irritable or they're coughing, take a video of how they're behaving. This information is very, very helpful if you follow up with your doctor to show them what it actually looked like when you were giving the food, right?
Right, right. And it's tricky too, because when you're giving new foods to infants, it's very normal for them to sputter and cough a little bit as well while they're getting used to the texture. You know, you brought up cow's milk dairy, and I think some parents are probably familiar that one of the more common food intolerances we see is when an infant has little streaks of blood in their stool, and that can be an indication of a cow's milk protein allergy. That also always warrants investigation by your doctor, and I would encourage you take a photo, if not also bring in a diaper if you see some like red streaking that you think might be blood in your infant's stool.
Absolutely. That is a very common presentation of a cow's milk food allergy, right? So hopefully in this discussion today, maybe in the first half, parents kind of saw the experience that I had with an infant with allergies, maybe felt a little bit reassured that a lot of times these allergies are short-lived and kids will outgrow them, and maybe a little description about what food allergy is, why it's serious, and why the management of food allergy has changed in the last 20 years.
Yes, and if you have any concerns or questions about food allergy or how to introduce solids to your child, I encourage you to be speaking with your primary care provider about this, or even an allergist if that's decided what's best for your child. This is 10 Kids, 2 Docs. I'm Dr. Vivian Carlin.
And I'm Dr. Sylvia Bank. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.